Okay, now number 3 on our check sheet is to prepare our solution. Now we're going to prepare our solution, okay? So we've gathered our supplies, and now we're going to prepare our solution. So we've checked our solution to make sure that it's clear and that we don't have any precipitants in there and there's no leaking, okay? We've gotten our tubing and we've clamped it off. We've made sure that there's no, that it's on off, that it's clamped down all the way down to a roller bar.
With how it's clamped off.
Okay, again, I'll show you. So see this roller bar goes up, and when it's up in this position, that means that a fluid can run through it, okay? In order for us not to just get a whole bunch of air bubbles in our tubing, we're gonna make sure we clamp it off first before we use it, okay, initiate it. So we're gonna pop off our top. Now this is sterile, so we're gonna make sure, did I touch it? Make sure that it's sterile. And then we're gonna take this off and make sure that it remains sterile. So, okay, and then we're gonna insert it. And the way you insert it is you just push and twist until you get it, you know, to the ridge. There's a little ridge right here, if you can see it, a little ridge. Now my tubing is turned off, so I don't have to worry about fluid coming in down into my tubing yet. But I want to fill my chamber halfway full so that when I actually put it on the pole, and you can do this either in the patient's room or you can have it prepared in the medicine room. Okay, so you can have it prepared in the medicine room because there are barcodes on the tubing, that's on the actual fluid itself that you can scan once you get in your patient's room. And then we're going to gently start unclamping, I'm rolling it about halfway through, and then we're going to watch our fluid. Turn it off so I can straighten my tubing out a little bit. And don't let your tubing touch the ground, okay? Because then you'd have to start over again. So watch your fluid as it actually comes through the tubing, and you can roll it out and then let it come until it comes to the end. And you can see it come to the end. You can see a little fluid leaking out, okay? And that's okay with normal saline because we have a whole bag of it. But if you have medicines, you want to be very careful because medicine's expensive and we don't want it to leak out. We want to make sure our patient gets all of it. And then we're going to inspect it to make sure that there's no air bubbles in our tubing. And there's none. That fluid is prepared and ready to go to the patient's room. Cut. Okay. So now we're going to enter the patient's room. Okay, going to knock on the door, go into the patient's room, and of course you're going to introduce yourself to your patient. Hi, my name is Debbie. Today I'm going to explain your procedure. Wash your hands. You can do all those things at the same time. You can be washing your hands, talking to your patient, and telling what you're going to do. You're going to start a doctor's orders are for you to start an IV. So you want to cut? Okay. When you go into your patient's room, before on your way into your patient's room, make sure you pick up a flush. Gonna need a 10 cc flush and some alcohol preps, and keep them in your pocket, okay? There's some in your kit, but you'll also probably need some extras, okay? And you'll take your bag of fluids and you'll hang them on the pole that's provided in your patient's room, okay? So of course we introduced ourselves. We told the patient about the procedure that's gonna be done on him today, and then we're gonna check your patient's armband, and you're going to check your patient's armband for their name and their date of birth, and you're going to ask them to state their name and their date of birth. Can you tell me your name? And his name is Sam Neal, and his date of birth. And then you're going to compare that to your MAR, because you're going to be rolling your EMAR into your patient's room, and you will actually have it up on your screen, and you will compare that name and date of birth to your patient's armband. Okay, that is your two identifiers. So Joint Commission talks about two identifiers, and that's what our two identifiers are: name and date of birth. Okay, so now your next step on your paper will be to we washed our hands already. Okay, we explained the procedure, we scanned his name band, and we asked him to identify himself, and that's how we're going to do that. Okay, And so we're going to ask the patient about any drug allergies. We did that because remember, we really have to ask him because there was no drug allergies on the chart. So we have to ask the patient about drug allergies, and he says no known drug allergies. Okay. Now we're going to start the process of initiating the peripheral access. Okay. So here we go. So of course you're going to provide emotional support for your patient. Before we initiate the IV access, peripheral access, we will make sure that we get our patient in a comfortable position, and we raise the bed into a comfortable position for us. Okay, so, and we want to make sure that we put a towel underneath the patient's arm because we don't want to make a mess in the bed and then somebody be mad at us about or we have to change the bed ourselves. So we're going to put a towel underneath his bed. Okay, we're going to raise the bed up. Okay, we're going to put it in, you know, like low Fowlers so that the patient's comfortable and the arm is, you know, in a good position, and we're going to lower the side rail. Okay, but once you lower the side rail, you cannot turn around and walk off from your patient. You have to make sure that you stay beside them. Okay, that's good. So, of course, you're going to provide emotional support for your patient if they're, you know, if they're anxious about it. Just tell them, you know, this. Hopefully, it won't take very long with one stick, and we can get it going. Okay. So we're going to open one of our catheters. Okay, so we've opened our catheter. So you know this is called an angiocath. We've opened our angiocath. We're going to open our supplies, our IV, you know, little supplies that came in. Of course, it has the gloves, a tegaderm, your tourniquet, tape, and this is ChloraPrep, and some of them come with ChloraPrep and some of them come with alcohol. It just depends on the manufacturer. Okay, so there you go. There's our 10 cc syringe. Here is our J-loop, or our micro bore extension that we're going to use for access. And what we do with that is, remember those alcohol preps we put in our pocket? We're going to actually get one of those out, open it, and we're going to scrub this hub. Even though we've just opened the package, we still want to make sure that we scrub it because we've kind of played with it, moved it around, so you make sure that we get it good and clean. And you're going to scrub your hub for like 15 seconds. Okay, so 15 seconds. And then we're going to open our normal saline. Maybe. Okay, and we're going to attach it. You see how it attaches? Just, there's no needle, so it just screws onto the port like that. And you're going to actually fill this chamber full of fluid. Okay, maybe. There you go. And you're going to make sure it drips, and that's full. Then you can kind of loosen this cap a little bit so that it's not so hard to get off when you actually put it into the patient's arm. Okay, and we're going to put that back into the package, the end of it, and lay it right there, easy access for us to get to, okay, when we need to. Now we're going to select and palpate for an appropriate vein. So when you do that, you're going to be looking at their arm, okay, and their arm, you know, this arm doesn't have any access, like a dialysis access, or the patient hasn't had a mastectomy, but those things something that you would be looking for to make sure that we don't stick that arm, because you can't put an IV in a patient that has a dialysis access on that side. You have to do it on the other side. Or if they've had a mastectomy, their arm sometimes is swollen and the blood flow doesn't flow good there, so you have to do that on the other side. So just remember, some of those things you're going to be looking for. Stroke too also can cause you not to be able to use that arm as well. Okay, so make sure that you select a vein. So we've selected a vein, and they're kind of bouncy, you know, so you just kind of look around and find one that you can see and you can feel. If you can't see it, then you need to at least be able to feel it. If you can't feel it or see it, then we have a little problem. And so that's why we use a tourniquet. Okay, so we're gonna put this tourniquet on, and wherever you think their vein is located that you want it to be like 3 or 4 inches above the spot where you're actually going to stick. So in order to put a tourniquet on, you have to pull it tight and hold it, and pull this one tight and hold it, and you're going to make like a little loop. You're not going to make a hole go all the way through, because you want to be able to pull it really easy when you get finished. Okay, so you're going to be able to pop it. Okay, so when you want to pop it, that's how you want to be able to pop it off. Pull it tight, and loop it through. Okay, did you get that? Okay, all right, so So that should pump up your vein, because arteries go this way and veins go back in the opposite direction. So the blood is actually flowing back up toward the heart. So that's why these veins pop up. Okay, so we want to make sure that we palpate one. Now we want to apply clean gloves. Maybe. So, and we're going to pop our little ChlorPrep, and we popped it, and we're going to go in a circular motion. We're going to clean it in a circular motion as we go out, and don't go back over the same spot that you've just gone over. And now we're going to allow it to dry for about a minute. All right, we're going to open our catheter. Our bevel, remember our bevel is going to be up. Remember our bevel. Okay.
Let's do a close-up of the bevel, Miss.
Okay.
Stay right where you are. Okay.
Okay. So now remember I told you that you hold it. This is how you stabilize it, with your thumb and your forefinger. You use your non-dominant hand and you hold the skin below the site where you want to stick. You're going to hold it taut, or you're going to hold it tight. Pull down on it so that the vein kind of pops up. Plus it gives you some stability that you can kind of rest your hand on. Then you're going to, okay, good. So you're going to use your non-dominant hand, and you're going to hold the skin below the site where you're going to stick. Hold it taut, hold it tight. Okay, so there you have your stabilized your catheter, your angiocath, and with your thumb and your middle finger. Okay, so we have our pointer finger free so that we can use that bevel up 10 to 15 degrees. You're going to go, as soon as you get that needle close to the patient's skin, you need to go straight in until you get blood return. You see blood return? When you get blood return, then you stop. You advance the catheter and you hear it click. Did you hear it click? Okay. So, and then we're going to release our tourniquet. Okay. And you can stabilize this vein to keep it from bleeding out. Of course, this is a mannequin, so you're not going to be able to keep it from bleeding out. But on a patient, you can press down on the vein and hold the catheter hub, undo it, actually put a 2x2 under there. And then we're going to get our extension, okay, and put it on and tighten it on. Okay, we'll make sure that we keep our catheter real stable. And then you're going to kind of pull back on it a little bit to make sure you get blood return, and then you're going to flush. And as you flush, you're going to be watching for any infiltration, and that means a bubble, or the patient says it hurts, or whatever reason there might be for that it doesn't look like it's going in correctly. And then we're going to take our Tegaderm, and they're easy to do. You just undo it like this. And you want to make sure that Tegaderm goes over the site, and then over the top of your catheter, and over the top of your microbore extension or your J-loop, so that it covers the site. You can still see the site, but then you can undo it, and you just kind of follow it around like that until it's stable, good and stable in there. And now your site is covered and your catheter is stable. Okay, you can actually peel this little piece of material off here, this little label, and it says initials, date, and gauge, and you write on that, and you actually put that on there so that the next person that comes behind you will know that that's your initials. You started this, the date that you did it, and the gauge that you used. Okay, and then we're going to stabilize it more with a little tape. Actually tape it down. Okay, and now that's your IV access, as your IV has been accessed. Then you're going to put that, make sure you put your sharps away and clean up your mess. But we're going to think about the normal saline that was ordered, remember? So we have to make sure that we start it up. And the way that we do that is, remember our alcohol prep. Open our alcohol prep and scrub the hub again for 15 seconds. Okay, make sure when you take this off that it stays sterile, because we're going to go into a sterile area, and the less germs we can do and introduce in there, the better off for the patient. And then we're either going to open this to the rate that's, we're going to actually put it in our pump, if you're you know, and set it to the rate that we want our fluid to run in at. Okay, and then we're going to clean up our mess. So because we want our patient to be nice and clean, and that's now we're going to complete the process. Okay, so just like before, when we started the process, we made the patient comfortable. We're going to make sure that the patient is comfortable, that we've you know, cleaned up all of our mess, there's no mess left, and that we put the bed in low and locked position, side rails are up ×2, call bell is within reach. Okay, and then all our supplies are discarded. Then we're going to wash our hands, and we're going to thank the patient, and we're going to go out and we're going to document. Okay, and what we're going to document is the date, the time, and the size of the catheter that we used, the number of sticks, okay, the type and amount of the IV fluid, okay, so type and amount, the rate that it's going to go at, and the device that we used to, so it's by pump, so we're going to put that's the device, so as a pump, and so then, and how the patient tolerated the procedure. And you're done. Thank you very much.